Welcome, everybody. My name is Dr. Robert Bagoff, and this is Dr. Stephen Levenbrook, my partner. And we would like to spend some time talking to you about the single-tooth anesthesia system. We've had this in our practice. I've had it in practice for over 20 years, and Dr. Levenbrook joined me about 4 years ago. And this is the only type of anesthesia that we use on our patients. We go back, 2200 BC. Babylonians had some type of pain receptor modulator that would prevent people from having pain, tooth pain, face pain. We come all the way up to the late 1800s, where Halsted used cocaine for the first mandibular block. Actually, we still call it the Halsted injection. Many people know it as the inferior alveolar block. He used cocaine. We happen to use different anesthetics today, most often xylocaine. Then came articaine, an amide and ester type anesthetic that is also a wonderful addition to the chemotherapy that we have to make patients comfortable during dental treatment. So the carpule hasn't changed in over 15 years. We have a rubber stopper that goes into a cylinder that elaborates a certain amount of fluid that will give the patient great anesthesia. Sometimes different types of anesthesia for the same patient are used to get a more profound result. In most cases, patient will say, I'm allergic to Novocaine. They're not really allergic to the anesthetic. They may have had a reaction to the epinephrine in it, or they may have just had a nervous reaction. They're really not truly allergic to it, like you'd be allergic to a bee sting. We look at different types of anesthesia and how they were delivered over the years. And I found this on the internet, and this sort of mirrors an experience that I had when I was a child. I grew up in Brooklyn, New York, and my dentist was a family friend. And my brother and I would go, and I once asked him, how do you know when you cannot use that reusable needle anymore to give anesthesia? And he said, without batting an eye, that when I can't stick it through your skin, that's when I stop using it. What it meant was these were quote unquote autoclavable, cleansable, reusable needles. And the more you use them, the duller they got. And it was a painful experience for most people my age. Painful injections are still used today. Probably two of the most anxious causing things in the dental office are the sound of the drill and the thought of getting an injection in your mouth. The single tooth anesthesia system for me, for Dr. Levenbrook and our patients, has changed the way that we look at local anesthesia. Infiltrations, V2 blocks, mental blocks, posterior superior alveolar. Basically, the chart is telling you that there is no type of injection that we give in the mouth that you can't use this system for. It works extremely well. We use conventional carpules, and the delivery system is absolutely amazing. We call it computerized anesthesia. We want to make sure that our patients understand that the device we use is to aid in their comfort and to give a more directed anesthetic infiltration to give them the most profound anesthesia possible. Dr. Levenbrook's going to go through some of the pictures that you see in front of you, which were taken from our office during routine restorative dentistry procedures.
Sure. Good morning. Thank you so much for having us speak on this. The STA system has totally improved our practice. Coming in, as Dr. Bagoff had mentioned, with 4 years of using this machine under my belt, I totally feel comfortable using this. And I think that patients really admire the technology that we have in our practice. And this is without a doubt one of the most exciting pieces of technology I think that we can speak on. So here, as Dr. Bagoff had mentioned, some of the photos are clinical photos and intraoral photos that we took while using the STA system. So I can walk through that. We find that there's not an injection day-to-day use that we can't provide with this machinery. So as we take our attention to the upper left of the screen, here is an inferior alveolar block that we'll use the STA system with. We can do buccal infiltrations for basic restorative needs. We love seeing the wheel of local anesthetic when we deliver our buccal infiltration. And as we work our way across, furthermore, we see apical buccal infiltrations. We can do some really comfortable palatal infiltrations. I know that's the dreaded injection for most clinicians and patients. But as we use some pressure anesthesia with our cotton swab there with some great topical, and using this STA system, our patients find that it's just a superior way to deliver a palatal injection that they've ordinarily had in the past using a common syringe. So as we can see here on the lower right, again, an apical infiltration there, and we can see our wheel of anesthetic that we're delivering very locally. One of the greatest advantages I find from using this system is that there's really no collateral numbness when giving an infiltration, and patients really appreciate that. Again, that's just one of the few advantages from using this system. But without a doubt, I think that this is a system that's really easy to use. The learning curve is very short. It's something that any clinician can truly add to their practice and enhance the experience for both the patient as well as the practitioner delivering anesthetic.
The nature of our practice is children, adults, seniors. We do extensive amount of implants, extractions, bone graft, scar tissue regenerations, aesthetic dentistry, restorative dentistry, periosurgery. We use a soft and a hard tissue laser. So pretty much most of our patients need to be numb in some way or another in a small area that will get them to be very, very comfortable while we're providing our service. As we look at this, the first thing we always do is wipe off saliva from the soft tissue. Saliva is a great barrier. We then use topical benzocaine, put a cotton roll or a 2x2 gauze up there for about 30 to 45 seconds. We then inject with the STA system through that area. And as Dr. Levenberg said, on the palate, we use pressure anesthesia with a cotton swab with some benzocaine on top of it. And the patients really have very, very little sensation except the profound numbness that occurs momentarily thereafter. Our goal, just like the goal of everybody sitting out there in the audience, is to do dentistry in a comfortable environment. Doesn't it set the hairs on the back of your neck to stand up when the patient says, I feel that? Well, we don't have that in this case. We want to make sure that everything we deliver is the best service we possibly can. When I first saw this on the market, I said, I had to have this. I had to learn how to use it, and I had to make sure that everybody I worked with was going to use it. There are other devices on the market, make no mistake. However, I have tried most of them, and I will tell you that this device is by far and away in our hands the best device we've ever used. It has such a smooth learning curve that we teach this to our residents, and I've had friends come to the office to themselves be anesthetized by this and do restorative dentistry, and then they go out and purchase the unit. This is a paradigm shift from dental school, where you're waving a big silver syringe in front of somebody's face. As best as you try and hide it, people know it's coming. For the dentist, as you see in the upper left inferior alveolar block screen, this is a pencil grip. It's very comfortable, it's easy. And the other thing is we do with many children that have never had dentistry before. So as we inject them for the first time, this is their first experience and hopefully a comfortable experience. As you look at the unit, it looks like something that's high-tech. We have it in every one of our operatories. You cannot find another syringe in the office except this device. So I want to share a little video with you.
The STA single-tooth anesthesia system is a computerized anesthesia delivery system that can do all dental injections utilizing a standard dental anesthetic cartridge. The STA single-tooth anesthesia system features the wand handpiece that comes in a variety of needle lengths and gauges depending on the injection technique being performed. Turn the power on to the instrument. Attach the foot pedal to the connector located below the volume indicator under the front panel. Slide the anesthetic carpule, metal collar first, into the cartridge holder and press firmly so the carpule is penetrated by the harpoon. Once anesthetic is in place, you will connect the cartridge holder to the top of the STA single-tooth anesthesia system and turn to the left. Once engaged, the STA single-tooth anesthesia system will automatically purge the tubing and push air through the tubing before beginning injection. The vertical scale at the top left side will illuminate, and all bars should be lit, indicating the carpule inserted is full. The remaining 4 bars each indicate 1/4 of the carpule. As each quarter is delivered, the light bar will go out and a corresponding tone will sound. Secure the wand STA handpiece into the needle cap holder on either side of the instrument. Confirm proper settings determined by the injection technique. STA mode has a single anesthetic flow rate. Normal mode has 2 anesthetic flow rates, controlled flow rate and rapid. Turbo mode has 3 anesthetic flow rates, controlled flow rate, rapid, and turbo flow rate. Depress foot pedal to activate flow of anesthesia. Begin the injection by depressing foot pedal lightly to activate the control flow rate. Once injection has been completed, return the wand handpiece into the needle cap holder using one hand.
So as you all can see from that video, it's a very simple system to use. It's an easy system to use. Patients appreciate it, and I think as clinicians you would too. We recommend the system to almost everyone. Dentistry as a whole, I think, has its first step in most procedures is anesthetizing the patient. And as we all know, first impressions mean a lot. So I think when you can master that skill of providing great anesthetic in a comfortable way, in a comfortable environment for you and the patient, the rest of the procedure goes a lot smoother. And I think that, online reviews and marketing from internal referrals are really the hallmark these days of growing a practice. And I can't tell you how many times that we read our reviews and the focus of the reviews are truly on the anesthetic and the comfortable anesthesia that we provide. So as you can see there, it's a really easy system to use. We as dentists are so comfortable using foot pedals and rheostats every day of our lives. I love the feature of having that audible feedback from the system itself, so you can be focused on the patient, delivering the anesthetic, and hearing in the background how much of that anesthetic you've actually delivered.
I'll tell you that I always use the control setting. We can do a PBL injection. We can do any type of injection. I also will give sometimes in the floor of the mouth if we're doing an implant or an extraction where the patient feels some pressure. I feel very comfortable using it. It's easy to get to. Access is amazing. And patient's comfort, as Dr. Levenberg said, is the key to success with any anesthesia. One of the most dreaded types of anesthesia delivery is the palatal incisive canal. And I'll tell you that again, in our practice for the patients, I've probably done over 500 of these. The patients feel a little pressure, and that goes away very, very rapidly. Most of the time for regular injections, I'll use Articaine, 4% with 1 to 200,000 epinephrine. For inferior alveolar blocks, I'll use xylocaine 2%. Sometimes we'll use Marcaine. Sometimes we'll use a host of other things. But those are the two main, xylocaine and Articaine, for our practice. The carpules fit right into the STA device. It is very easy. Everything is thrown away when you're done. We wouldn't even think of reusing it. It's not meant for that. The goal is, again, make the patient feel comfortable. They see something that's high-tech. They understand the delivery system. We, in fact, explain this to the patients prior to giving any anesthesia. Patients are referred to our practice because many of them are either medically compromised or are phobic. And we love treating patients like this because we can change their look. We get an outlook on dentistry. We had a physician come a couple of weeks ago that hadn't been to the dentist in over a decade. Very smart gentleman, understood his needs, and was absolutely terrified. He was sitting in the chair and sweating and almost shaking. We sat down. Dr. Levenberg did 3 quadrants of dentistry on him, and he can't wait to come back for the next visit. Comes back for the next visit, he's a different human being. And he's already referred patients to us. The goal of any surgery, any dentistry, is to make the patient comfortable. Could you imagine going into an operating room to have some type of surgery done, and the anesthesiologist says, I hope this is going to get you numb. I hope you're going to be comfortable. With this, there is absolutely no doubt in our minds. It is comfortable for the patient, and it's also comfortable for us to deliver. As you look at the different injection techniques, we can make sure that the anesthesia is local, focused, and gets the job done. In many cases, we can use a lot less volume and get a greater result depending on the procedure we're doing. We also do not see patients with lip droop. Now, one of the interesting things Dr. Levenbrook and I were talking about earlier today is there's never been a dentist who doesn't say they give the best injection in the world. Absolutely, amazingly, the best injection in the world. One of my faculty members, when I was a student, his hand was shaking like he was in an earthquake. And patients were looking at that, they were arching their back and literally levitating off the chair. And I always remember him. And he kept telling me how wonderful his injection was. A number of years later, I had a few of his patients come to my practice. And they had other things in their mind that they wanted to share about his injection technique. So what I would say is you should try. Have this done to yourself, and you will see that this is truly amazing. And then take some of your patients and try it out. See if this isn't more comfortable for you and more comfortable for them. Again, as we look at the different anatomy, places we can inject, it is much easier. The patient, again, does not see this long silver device going into their mouth. It's comfortable. It fits into the palm of your hand, and it's easier for you to deliver. In aesthetic dentistry, we want to be focused. We want to make sure that the patient is profoundly numb in the area we're working. And we want to make sure we give them the appropriate amount of anesthesia. This makes it simple, it makes it easy, and it makes it comfortable. It's a win-win-win for the dentist, for the patient, and for the practice. Many times when the patient walks up to our front desk, the patient says, you know, the anesthesia is worn off, and I feel absolutely nothing.
Yep.
We'd like to take this time to thank you very much for spending this time with us, listening to what we have to say. Hopefully, we've given you some things to think about. You'll go to the Milestone Scientific website and look up more about this. Look online for us. We've done a YouTube video. And if you have any questions, please ask them now.
I know we're going to have a Q&A session that we're happy to answer any questions through that link in the chat. But as Dr. Bagoff had mentioned, I think that this STA system is really, truly what's going to make your practice stand out from your competitors. When patients come in and they see the advanced technologies in our office, they're immediately blown away. And this is by far one of the most advanced technologies that we have that they focus on. And they know that when we take pride in advancing our technologies in the practice, that they made the right decision coming to our office. So I think that this is something, it's very easy to use, that's truly going to allow you to stand out from your competitors in your practice. So we're happy to answer any questions that we might have for the webinar. I know that you can enter those questions through that chat, and we're happy to respond verbally.
And ask anything you want. We're conventional, average, everyday dentists that are always looking for a better way to make our patients comfortable and deliver the service that we all do. In various states, it's a great question. In various states, hygienists with advanced training can deliver local anesthesia. So yes, you have to go to your State Board of Dentistry, State Board of Hygiene, and look at the Practice Act, and it will let you know whether they learned in school and have a certificate of anesthesia, or they've taken a course afterwards and they have a certificate of anesthesia. Depending on the level of interest and skill of the hygienist, usually Dr. Levenbrook and I would feel comfortable having any one of our hygienists deliver infiltration anesthesia, but for a block, whether it's a V2 block or an inferior alveolar block, we would be the people to deliver that. Dr. Levenbrook?
Are there any contraindications for any patients? I don't find so. You know, any patient who comes into the office or in their past has used a syringe for anesthetic, I think this is only going to be a more comfortable experience. I don't know if any contraindications for you.
There's no contraindications. There's no electronic device that would be near the patient. It doesn't heat up. It's just a different way to get the solution through a very similar, and we use 30 gauge needles to the patient. It makes a lot of sense. And again, we deal with medically compromised folks. We deal with patients who are phobic. This is, in our estimation, the best device that we could possibly use to deliver anesthesia.
Sure, we'll use a 30 gauge one for a block and a 30 gauge half for an infiltration. But again, just a different modality for delivery of anesthetic that patients have had in the past or are used to having in the past, just in a more comfortable way. The gauge and length, a 30 gauge, and it's 1-inch needle for the inferior alveolar block, and a half for the infiltration or palatal infiltration that we'll use.
No, there's absolutely no reason a registered dental hygienist shouldn't give a block. In our practice, the patients feel very, very comfortable with certain procedures. And I think that in other procedures, they would rather us do it. It's absolutely up to the patient. We are happy to sit and assist our hygienist, giving the block till they feel comfortable. No, I have absolutely no hesitation about having the hygienist well-trained to give the block. Absolutely not.
Yeah, I agree with that. I don't have any reason why they shouldn't. It's just a comfort level for the practice and the practitioner.
Yes, there are other systems on the market that are similar in that they give anesthesia via pneumatic system. However, having said that, and mind you, I will tell you that I have used most of them. I find that in our hands, this is easy to identify. It sits on a countertop, does not take up a lot of space. The patients come into the room and look for it. They want to make sure that we still have it, as some of the patients ask, you still have that machine, right? Yes, we do. But yes, there are other devices on the market. This one, after trying a number of them, seems to work best for us and is the easiest one to teach our residents and our colleagues.
Sure. Yeah, I think that this is the system that stands out for us. Go ahead.
The purchase of the product, I believe you'll have to contact Milestone. There are vendors that we deal with that we purchase the needles from. I am not sure if you can purchase them directly from Milestone. I would ask that you contact Milestone. But just like most other products, I believe that they will send you to one of the local vendors that you can purchase them from.
And while we're waiting for the next question, just to inform you guys in the audience that as you saw in the video, there are different tubings, different needles, different applications that you can use the system for. So sometimes those needles will come pre-attached to the tubing. So depending on what type of injection you'll use, there's different products that are out there available for you.
I have used a different system for intraosseous injections, and I will tell you that I find that I get no better anesthesia with an intraosseous system than with this system. And in fact, I will shy away from an intraosseous system. You have to drill into the bone. And to me, that allows an area going into near the root if you don't get it in perfectly. And I have never had a case where I can't get the patient numb using this device. Are there any change in volume delivered with the infiltration injections? You can use a foot pedal, and the foot pedal, as the video showed, you can have 3 different delivery systems. I happen to use the conventional system, and I vary it with my foot pedal. I go very slowly to start, and a few drops more. And I'm constantly talking to the patient and shaking their lip a little bit while I'm doing this, so to distract them. But you can go as fast as you wish or as slow as you wish.
Sure. As far as I just want to piggyback on that, as far as a change in volume, I just find that the delivery system, by using the SDA system, allows us to have much more localized anesthetic in the area that we need. So I find that I'm actually using less volume, but I'm achieving that same amount of anesthetic and anesthesia for the patient. So as far as a change in volume, we're still using the conventional cartwheels as we saw in the PowerPoint, but I find that I'm just delivering less volume in total to get the profound anesthesia that I need to perform that procedure.
So one of the questions was cost compared to other systems. So let me tell you that I started out in dentistry using a low-speed drill, and high speeds were introduced in my senior year of dental school. So high speeds cost more money than low speeds do. Over the years, we have found that there's a cost of delivering dentistry, whether we went from a paste-based composite system to a visible light cured composite system to a laser to a hard tissue and soft tissue laser. So yes, compared to a silver conventional needle system, this is much more expensive. However, having said that, the worth to the patient is insurmountable. You want to have your patient have the best treatment possible, and if they're comfortable at the start of the treatment by giving them comfortable computerized anesthesia, you can put a value on it. But yes, it's more expensive than a conventional system. It's in the same ballpark range of the other high-tech systems, however. We have one machine for every room.
Oh, yes.
I would never move it from room to room. The only thing that moves from room to room is us.
Yeah, I think you're going to want one in every room. It's so easy to use. Patients love it, and we love having it right behind us. As Dr. Bagoff said, it takes up such a small footprint on our counter space that it's really, you're going to see. And when you have one in one room, you're going to want one in another. It's the same with this method compared to do all the injection sites the same with this method compared to I think from all the injections that we saw in our PowerPoint today, we provide those effortlessly with this system. So you can use this system to provide anesthesia for all those types of injections and in those injection sites.
Okay. The question was how expensive, and again, I think you have to contact Milestone and speak with your local dealer. Just like any other product on the market, I think each dealer has its own price point, so I can't speak to that exactly.
Cost of the unit, again, I think you'd have to contact Miles.
The couple of things that are exactly the same. You can buy the tubing without needles, and you would just use the regular needle that you would on the silver syringe, or you can get it with the tubing. The anesthetic carpule is your regular anesthetic carpule that you've always used. Mm-hmm. How do we sanitize between patients? Everything gets thrown away except the unit. The unit is wiped down just like we do the bracket tables with, what is that?
The cavi wipes.
Cavi wipes. Cavi wipes and cavi wipes too. We wipe the entire unit down, but the tubing, everything else is thrown away.
Everything else is thrown away. Yeah, we use brand new one for every patient.
One of the questions, I'm having trouble understanding how this is fundamentally different from my traditional delivery. What makes this different? The patient does not see the syringe coming towards their face. Secondly, it's easier in a pencil grip than a conventional grip between your fingers and your thumb. I find it easier. This also does wonderful aspiration.
It's built-in feature to the unit. So I find that when we can control the pressure by using a system that will deliver anesthesia, no matter how slowly you deliver that injection using a traditional syringe, it's really that pressure buildup that causes discomfort for the patient. So by using a computerized, or what we call computerized anesthetic system like this, we allow the system to deliver that anesthetic in a much more controlled and slower rate, which truly results in more comfort for the patient. So it's a consistent flow. It's a more predictable outcome. It ensures no high pressure injection, no intravascular injections. It's mentally and physically easier to use for the practitioner. And like I said earlier, no collateral numbness. So there's a lot of advantages by using this system compared to your traditional delivery system.
And I wanted to bring out that both Dr. Leverberg and I teach in a dental school and a general practice residency program. For newbies trying to master giving an injection with a conventional syringe, we have found that they take to this very easily and they have greater confidence using it. Now, if you find that in your practice this makes no sense, then it makes no sense. There's no way we would want to change anything that you're doing with a high degree of success. However, there are a number of patients who are looking for somebody who will provide computerized anesthesia. They're looking for something different. You may open up your practice, so put one device in one room and try it. See if it, and advertise that you have computerized anesthesia. For 75% of your patients, this is going to be an amazing adjunct. For 25% of the people, it may bring those people in who are terrified of anesthesia, and the concept of computerized anesthesia gets them over the hump to do this. Also, with children, you'd be surprised how many people are on the internet looking at how a dentist delivers anesthesia. When they see this totally changes their perception of what we're doing.
How long does it take to deliver a full carpule? I think that depends on the type of delivery rate at which you're choosing to use. Traditionally, we use the normal flow rate, and we can deliver a full carpule, I would say, about 30 seconds to a minute or so.
It took me 40 seconds to deliver a carpule this morning to one of my friends who's a surgeon. And I did a crown and a build-up. He was numb almost instantaneously. Very happy guy. In fact, now he's looking at this system. We were talking to him about it, to use it on skin for some of his patients. He likes the concept of how we delivered it, and it may have a very viable application in medicine. It's been on the market, I would say, probably 20 years, give or take a year or so. In my mind, is tried and true. It's gone through, I think, 3 or 4 iterations. Somebody said in a blog I was on that they think they should change the color of the outside. I guess you could do anything you want with the outside. The concept is the mechanical device, how easy it is to use, how systematically you can continue to deliver anesthesia. And as I said before, our patients look forward to this. How do we get referrals because of it? Why would this give more profound anesthesia than traditional? Why would onset be quicker than traditional? I find that, at least in my hands, I can direct it better with a pencil grip than I can with the conventional silver syringe. I also found that I can use less anesthesia because it's more directed. Many times people do not get the anesthetic below the periosteum. And if you're trying to get a tooth numb, the key, at least in my mind, is to get the anesthetic below the periosteum. And if you're doing an extraction, if you're trying to get to the lingula to give an inferior alveolar block, again, in my hands, in my mind, it makes it easier for me to direct that using a pencil grip. The turbo mode versus the other modes, the difference, please. The turbo mode is injecting very, very rapidly. So if you've gone to YouTube and seen some of the videos where an oral surgeon is blocking for wisdom teeth and the patient has IV sedation, you'll see that they're injecting very, very rapidly. So again, the turbo mode can give you very, very rapid anesthesia delivery. Again, in my mind, I would rather take a solution and put it into a space slowly, make it more comfortable for the patient. And all of our patients are awake when we're working on them. And I like delivering something into that space slowly, because you're pulling up bound down tissue. And even in the inferior alveolar, you know that if you get close to the lingual nerve, patient may jump a little bit here. Again, in my hands, it's easier for me to direct it, more comfortable. And it's psychological for a lot of our patients.
Yeah, I agree. I think that having that consistent flow and the normal slower rate just provides for more comfortable anesthesia. As far as onset to be quicker, I think that there's a lot of, empirically, we see a lot of patients who are very nervous, very anxious, and it takes longer for them to get numb. But when we see and we show them that this is the delivery system in which we use, I find that the onset does become quicker than traditionally, when a lot of those nerves or anxiousness is alleviated by the technology that we have in practice.
Yes, and so you're asking if we have increased tactile sensitivity. Absolutely. Without a doubt, my fingertips feel much better than the type of grip you have without using the tactile sensitivity of your fingertips. Imagine taking a high-speed handpiece and using the palm of your hand to drill as opposed to your fingertips. With your fingertips, most of the time, you have a better tactile sensitivity. So too here. At least in our perception, we do. So at this time, we'd like to take a moment to thank you very much. Your questions are very well pointed, made a lot of sense. We hope we've answered the questions to the best of our ability to help you understand how we use it, what makes sense to us, and how it's enhanced our practice, and how it's enhanced our patients' comfort in the office.
Yes, I just want to thank you, everyone, for tuning in, for Milestone, for having us speak on this incredible piece of technology that we've incorporated into our practice. And I'm truly hopeful that this STA system will improve your practice, and it'll lead to your practice growing, whether that's through internal referrals, through marketing. I think that this is a system that'll make procedures safer for your patient and provide them comfortable anesthesia for you. And it'll just lead to more productivity and efficiency in your practice.
And again, have a wonderful weekend. Thank you so much for joining us.
Take care.
Bye-bye.